There, I'm Dr. Houle.
And I'm Dr. Katherine Hoell, physical therapist.
And we both work at Cape Cod Healthcare. I'm a neurosurgeon.
And I'm a physical therapist, and I work in the Golf Performance Center as well.
We're both TPI certified, and I specialize in spine surgery, and a lot of my patients come to me for back pain, and I send them to Katherine.
To help them with their back pain through physical therapy, but we also share a liking to help golfers, not only with their back pain through surgery and rehabilitation, but now with performance in the new Golf Performance Center at Cape Cod Healthcare.
So people always ask me, is golf bad for your back? And actually what we've learned through TPI is that actually your back, low back, shouldn't really be involved in your golf swing at all, right? Tell us why.
Exactly, because when we're trying to rotate around a golf swing, we really want to get our rotation not from our back, but from our mid-back and from our hips especially. And I find when I evaluate people in the Golf Performance Center, when they have back pain, I definitely want to look at their hip mobility, because I guarantee you they're going to have some restrictions, and most likely that's leading to back pain in your golf swing.
And as it so happens, I have some limited hip mobility issues that we're going to measure today, and then we're going to introduce a technique that you have called dry needling. Why don't you tell us what dry needling is?
So dry needling is a technique that uses a small filament needle to go after trigger points in a muscle or tissue that's bound up that may cause restrictions affecting mobility, pain, and power, which is all important in your golf swing. By releasing those trigger points, it actually allows blood flow, reduction in pain, and then we can stretch out the muscle or move the joint better, and you'll see more fluidity and power in the golf swing after that.
So let's go ahead and go do the assessment. Then we'll come over here to the range and do the K-vest and look at the swing before. We'll do the dry needling and see what it's like afterwards.
Perfect. To assess hip mobility, we're going to look at both sides. We're going to have Dr. Houle start on his right leg with a left toe kickstand, and we're going to assess your right internal rotation. So you're going to try to rotate your pelvis to the right. That club should go past the tape, and you can see he doesn't quite get it to the tape, which is 60 degrees. So that's a fail in terms of having the mobility you need for the hip rotation. So now we're going to look at his external rotation. Same position, you're going to rotate to the left, and you're going to try to clear the club head to the other side, and he does that nicely. So we've assessed restrictions in the right internal rotation. Now we'll do the left side, testing the left side, standing on your left side with a toe stop on the right. You're going to turn your pelvis to the left and try to clear that golf club over the tape. He just gets to it, not over. So again, there are limitations in left hip internal rotation. Now we'll test the right side, rotating his pelvis to the right, and he is able to clear that on his left side. So his external rotation.
So you're about to stick these gigantic needles in my leg?
Actually, no. They're 38 gauge, so they're smaller than a hair.
I don't know, I'm kind of afraid of needles. So do you have a lot of people that are afraid of needles?
People we do dry needling on, they have to be comfortable with this technique. And if they're not, there are other modalities. But the dry needling is very effective when you're trying to go after a trigger point, especially with an athlete with well-defined muscles. It really helps to release the trigger point, which is going to lengthen the muscle and take pressure off of the joint that's restricted. In your case, your hip.
Wait, you just said I have really defined muscles? I want that recorded.
Absolutely. Yep, good athletes. So what we'll do is we'll find a trigger point, which we've found. We've already identified the blood vessels in the leg, so making sure that we're not going to hit anything we don't want to. And we found a nice trigger point here. That's it right there, correct?
A little bit lower, towards my knee. Yeah. A little bit more.
I feel like right there is.
Right there, yeah.
I think we found it.
Found the
All right,
point.
so you're going to feel a little tap. The technique itself is actually pretty.
So is the needle in there?
The needle is.
So I didn't even feel that.
Well, we're now just trying to get a little pistoning action to try to get a contraction followed by release. This is a local twitch response, which it's going to cause a contraction followed by a release. That was actually good. The needle is out. We had a little compression. And so what that's doing is it's causing a local twitch response. The muscle is contracted, and as I say, muscles are stupid. They only do two things: either contract or they relax. So if they're really contracted, that means it needs to be released. So when the needle goes in, it's magical in a way. Our bodies just respond to it, and it actually stops that neurotransmitter loop, that acetylcholine that is causing that muscle contraction, and resets the loop, calms it down, allows it to release. So you'll feel a contraction followed by the release, and that's the technique. So I found another one right here. So we're going to go ahead and do another one.
So what's really interesting to me is that the pressure that you put on my muscle after you took the needle out was actually more uncomfortable than the actual needle itself. So for people who are maybe a little bit concerned, especially guys, especially when you're working on your inner thigh, okay, I felt that one.
Yep, so you felt a little contraction.
Little contraction, and then, but it doesn't really hurt, it's just maybe uncomfortable.
Exactly. I have a really gentle technique. You see all kind of techniques. A gentle one is fine, and you don't have to leave the needle in. Once you make the contraction, the work is done. Your body is now sending sentinels of proteins, cytokines, all kind of things to actually accelerate the repair process.
Yeah, that was really nothing.
We'll do one more here at the sort of rectus femoris tendon, musculotendinous joint here.
Again, I just feel a little bit of pressure. And I can actually sort of feel that I felt the contraction right there in the muscle.
Yep. So after the contraction, that's going to be followed by a release, and that's where people will then see the results of more mobility in the joint that we're affecting, again, in this case, the hip. So I want to do one more, the tensor fascia lata on the outside. So because Dr. Houle had restrictions in internal and external rotation, we want to make sure we get the medial and lateral sides so that he has a little bit more mobility. So we'll just kind of hit that TFL here.
And of course, because my muscles are so well defined and so muscular,
It's
so easy to find it.
It's very easy to, you probably feel that a little bit.
For sure. Yep. Absolutely. But again, it's not pain. It's uncomfortable, but I wouldn't call it painful. And I just felt the contraction there.
Perfect.
And there too.
Yeah. This works really best on healthy individuals, people that have a good immune system, people that, work out regularly, have a good blood supply. That's where it really works the best, this kind of technique. I'll do one more. The IT band is a little tight, and that can
So just tell people what the IT band is.
Yeah, so the IT band is a long structural collagen fibrous band that attaches from the hip all the way to the knee. And it's very helpful. It helps with not only lateral structural support, but it does assist with moving the hip and internal rotation and abduction. So it's helpful in the golf swing, but if you don't have a good core...
Oh, I felt that, for sure.
If you don't have good core and glute power, the IT band can be overworked. When it's overworked, that's where you see it become really tight. That's why it's prolonged standing. Runners get this a lot. Golfers, if you're overusing it, then it can cause tightness and restriction in the hip as well. All right, we'll do one more so you feel that tenderness there a little bit.
Not too bad.
Not too bad. We'll do one more.
That was more like a burn going on. I felt that pop right there, that contraction.
Yep.
Again, this burns a little bit more, but again, not terrible.
Yeah, the burning is that blood flow going into that site. And we'll do dry needling on 3 points. We can do a dry needling on a point where you feel it sore. We can do it on a latent trigger point where I pressed here. I could feel the tension, but you didn't feel the pain. And then I also do paraspinal points because that is where you get all the central nervous system, and we can affect not only a local response, but also a systemic one. And there
Excellent.
You go.
All right.
Dry needling.
So now let's go over and see if it affected my swing at all.
Sounds good. The pelvis side bend is significantly improved. That's the green light. The pelvis side bend at the top, you actually are closer to range. That's the second number. You were in the 20s before, so you're having less pelvis compensation. That's how that would show up. And the rotation and address, you're a little more closed, but that's okay depending on the shot you want. So I would say the pelvis side bend impact has definitely been improved there.
Oh, that's outstanding. Let's go over and do the reassessment and see if there's been any change.
Let's do it. After we've done the dry needling treatment and the mobility drills, we're ready to check to see if you have more internal rotation, especially on that right hip. So we're going to rotate again, doing the same test, and you can see that the pelvis and the club shaft goes well past the black line, which is at 60 degrees, so that's fantastic. Looking at external rotation, actually that too has significantly more rotation. So it's a passing grade for hip mobility. Let's check the left side. Even though we didn't do that, he did the mobility drills. Sometimes that can help, rotating to the left. That actually showed improvement just with the mobility drills. And then to the right, the one thing that we did notice is that he had less pain when he did, and that's what really helped the dry needling with the right
What
hip.
I notice here is that I don't feel the restriction. Before, when I would get to a point and then I have to push past it, I can go past that point and I don't feel a restriction. Remarkable. I'm a believer.